Gauteng has almost 14,000 active COVID-19 cases. The province's health department is urging people to continue obeying lockdown rules. This as data modeling by the National Institute for Communicable Diseases indicates that Gauteng will be the hardest hit province in the third wave. For more on this, I'm joined by Harsha, Somaroo, a public health medicine specialist at the Wits School of Public Health. Thanks for your time, Harsha. Appreciate it. So looking at these numbers, how concerned should we be?
So I think we should be relatively concerned. We've had a sustained number of cases, COVID cases in the province over the past few weeks. And with the recent predictions by the modeling consortium, I think even though the numbers are not in keeping with this resurgence, we are concerned because we want to decrease the incidence at the moment to actually try to prevent the potential resurgence in the province. So I think what's more concerning to us is that we are seeing an increased number of cases in specific areas, and we're seeing clusters of cases amongst families in certain schools and in workplaces. So I think it's important for us to really stress the behavioral measures and the non-pharmaceutical measures in Gauteng so that we can minimize transmission and really have an impact on this virus.
You know, during the long Easter weekend, many experts were saying that people will go away to the coastal areas and come back with infections in Gauteng. That, of course, has long passed. So what do we reckon is causing the spike in the province now?
So I think we did see a slight increase in the cases post-Easter, though it wasn't sustained. Right now, we think that, so I'll mention the areas to you. We're seeing an increased number of cases in Mfuleni and Sedibeng, in Joburg Subdistrict C, as well as in Tshwane Subdistrict 3. And what we do know is that the teams on the ground have investigated and determined that there is difficulty with people adhering to the behavioral mechanisms in these areas. So we feel this is the largest driver of the increased transmission in the province. And if we can appeal to the public to actually adhere better to wearing a mask in public and to wearing it correctly, to making sure that your nose is covered when you're wearing a mask, as well as to maintain physical distancing of 1.5 meters in public areas, and to maintain the behavioral mechanisms in terms of hand hygiene and respiratory hygiene as well. These sound so simple, but it is difficult for everyone to actually sustain these behaviors. But if we can do that, this is probably the biggest impact we will have on the transmission of cases in the province.
And these 14,000 active cases in the province, compared to the first and second wave, how is that looking, you know, in terms of seriousness about us being worried?
Okay, so I'm not sure about the number, Shahan. I think it's under 4,000 active cases at the moment in the province. But yeah, in terms of the active cases are the cases who pose a risk to other people in the province in terms of transmitting the virus. And a lot of these people are asymptomatic. So, and they may not actually, people may not realize that they're in contact with somebody with COVID and may not realize the importance of adhering to these behavioral mechanisms. So, yeah, it is always a concern, as much as the numbers are not as high as the previous wave. Because we have sustained transmission, we do need to act now so that we can actually prevent resurgence of cases. Or if, we are heading towards winter, and in the colder season, I think people do tend to stay indoors and ventilation is poorer. So those might actually also be drivers of an increase in cases. But if we are to see an increase in cases, we really need to minimize that number best we can.
Yeah, sorry, you're actually right. That intro was wrong. It is just over 3,000 active cases in Gauteng. So the third wave, we've obviously heard experts say that it is coming, it's coming. When is it coming? Do you have any expectations on a couple of weeks or another month?
Yeah, so there's no time linked to the modeling at the moment, and that's because there's so much of uncertainty associated with COVID-19 and the transmission of cases. I think if there's emergence of a new variant, this might increase the risk of increased transmission and quicker transmission and an increase in cases sooner rather than later. But if we continue with the current scenario and what we're seeing at the moment, it might take longer. But I think what we do need to emphasize is that it is in our hands to actually try to prevent this. It is in the hands of the population as well as the Department of Health and our response to support people to understand the virus and the dynamics and the preventative measures better, so that we can all work together to actually decrease cases and really prevent this third wave from happening. As much as Gauteng is predicted to be the hardest hit, we really want the people of Gauteng to pull together and prevent this.
All right, thank you so much for your insight. Appreciate it. Harsha Somaroo, a public health medicine specialist at the Wits School of Public Health.